Namaste all the viewers and friends. Today we've again come up with another topic for discussion, which is called the Bell's palsy or the facial palsy. We've been doing a lot of videos, we've had a lot of views, we have had a lot of subscribers to our channel. We wish and hope that the process continues, that we keep continuing the video making process, and we have viewers and subscribers who go through the video, understand it and share it amongst the people who are needing the information basically. So today, like we discussed, we're talking about Bell's palsy or facial palsy. So facial palsy, the word palsy means there's a partial reduced functioning of the nerve. Okay, so happens usually on one side of the face, and face being one of the most important part of our body, which is important for expressions, which is important for talking, for viewing things, for smelling, for eating, which is all very important. There's nothing that the face does which can be neglected and which can not be done for a day or two. So when something is affecting the face, it is also very important that it is treated properly and it is treated early. So the palsy or the reduced functioning of the nerve that supplies to the facial muscles usually happens because of an infection. Most of the times viral infections that affect the nerve, and it can also be because of an inflammatory process that's happening in the nerve that causes swelling of the nerve, mild degenerative process that begins in the nerve. So what is the cause is most of the times unknown. Usually it is seen that as a viral disease, viral infection, but many a times even without a symptom of an infection, somebody can end up having facial palsy, and it can happen in any age group, any gender, and it can also reoccur. It doesn't mean I've had facial palsy once in my life and I will not have it again. It can recur as well. So what are the symptoms? How do you recognize it? One side of the face, the functions of it reduces. Basically, the muscles become weak. The angle of the mouth deviates. Most of the times they say, or it is said, that one side of the face drops down. So the eyebrow drops down. It becomes very difficult to close the eye. The face seems like it is tilted to one side and the angle of the mouth is changed. So what are the symptoms? What are the difficulties that are faced because of it? Like I said, closing of the eye becomes very difficult. It can also affect the tear formation of the eye. It can either increase or it can end up with dryness. There can also be issues with gulping the saliva inside, so there can be drooling. Sometimes there's change in the taste of the food that is eaten. It becomes difficult to chew the food on that side. The ear can become hypersensitive, so the sound signals can there can be change in the way that we hear sounds. Along with that, there's most of the times pain in one side of the face, a lot of difficulty because of the, you can imagine when there's either a toothache or an ear pain, it says the whole face is paining and it is very uncomfortable. So you can imagine when one side of the face is going through inflammation, there's a lot of pain in that side. So it can affect the sleep cycle as well. Many a times it is a self-remitting condition, usually takes up to 6 months to 8 months. It usually come back to the normal functioning. But for some people, the damage that the viral infection causes can remain lifelong. So certain changes can remain. But when it is treated early, for example, you start recognizing the symptoms and you approach your doctor and get yourselves treated early, the outcome of the treatment is better. So you can expect recovery from facial palsy within 1 or 2 months itself. And we have seen that very beautifully with acupuncture therapy. So when acupuncture therapy is done, when a person is going through Bell's palsy, we've seen that within 1 or 2 months, the face returns back to the original shape and function. So the eye closure, the angle of the mouth, the cheek muscles that droop down, everything shifts back to normalcy when acupuncture is done. So what basically acupuncture does is it brings down the inflammation of the nerve that is affected, and it helps regenerating the nerve cells. So when there is an infection, or for whatever causes, when somebody is going through inflammation, the nerve is the surrounding structures swell up. So that inflammation needs to come down for the functions to come back to normalcy. So acupuncture brings down that inflammation. It improves the musculature health, so that whatever muscles have gone weak because of the palsy, it starts functioning back normally. It also improves the salivation, it improves the tear formation, it enhances the taste, and it also can bring down the hypersensitivity of the auditory nerves, so your hearing gets back to normal. So this is what is the role of acupuncture, irrespective of when you started. You started immediately after you've gone through facial palsy, or after some time you try multiple treatments, you also want to try acupuncture. So you take time to start acupuncture. Both ways the results are very, very promising. So we have seen very good results with acupuncture. One thing that you should do along with acupuncture is not to expose yourselves to cold wind, because cold wind exposure can worsen the symptoms. It can delay the healing process, it can delay the outcome of the treatment. So acupuncture, along with certain remedies like this, not exposing to cold wind, eating good food, good lifestyle, stress-free life, sleeping well, all of this lifestyle correction along with therapy is promising. With that, I end the topic of discussion today. If any of you or your friends are going through Bell's palsy, please feel free to contact us or visit our clinic, Anandamaya Wellness Center, and we'll be very glad to help you out on healing your facial muscles and bringing back your smile to origin. Thank you very much.